Hello, Sir Survivor here, and today we're going to look at building a long-term first aid or medical kit. Now the idea behind this kit is not so much having things that I personally will be able or always use, but I'm building this kit with the idea in mind that I could pass this kit off to a nurse or a doctor and they would be able to perform, minor surgery to take care of injuries and save people's lives if need be. The reason I chose this bag, this is an old VHS camera bag. I've had it forever, and I'm just going to repurpose it here. And the reason I am is because of the storage capacity. You have these removable inserts in it. We've got storage on the side. We got storage on this side, and we've got storage on the front here. So a lot of storage room, and that's going to be really good for a lot of things we're going to look at. So let's get started. And starting off with, we're basically just looking at Band-Aids, for minor cuts and wounds. But the main thing about this is you want to make sure you can store these in a place they're not going to get wet, and preferably in something like this, an airtight type of container, and get all different types. Here you can see I have the large types, the large types here. And all the way down to these small, very small ones that we see there. So all the way down to that side. Also, like these, they have a little antibacterial medicine on the bandage itself, or the Band-Aid itself. So putting all the bandages together, I'm gonna end up with a lot of each. I'm thinking about at least a minimum of 20 of each type. So I'm gonna put together as many as I can here. All right. And what I've done here is I've taken all of the Band-Aids that are, your average size and smaller, and I've combined them into this one bag here and made sure that it's airtight, there's no air. And I want these to seal up good so that I don't have to worry about them getting wet. And I've taken the larger adhesive bandages and I'm putting all of the larger bandages into this one. So that's, just the beginning, the normal things we would put in the beginning. What we're looking at here is our alcohol prep pads, our antiseptic towels, our iodine wipes, our burn cream, antibiotic ointment, and as we can see we also have some antibiotic ointment here, anti-etch, our other types of creams, more antiseptic towels, antibiotic ointments. So I'm trying to combine, what I'm trying to do here is combine the most commonly used, or what I believe will be the most commonly used items. So I'm going to try to organize this also into a couple of more of these waterproof bags. And these are some good items to go on the outside of that bag we're looking at. So let's put them in some bags. And you also have this BioFreeze, this pain relieving gel that can go on. It makes you really cold. And it's supposed to help relieve joint pain, any type of aches or pains. So I'm going to put this into the other category with the medicine here. What I'm trying to get in this one here, just in this one, I'm trying to get all of the antiseptic, the antibiotics, and those types of things, because they just sort of make sense to store those together and then store the various pain relievers and ointments and things like that in a package themselves. I also have 4 of your chemical decontamination packets from the military, and I'm going to include these in with the next section right here, but I think I've got all so far. Well, I can probably fit these into these alcohol prep pads. I think I've got a good bit in there, probably a couple hundred of each, so we're gonna see how that goes. All right. Okay. Next, I'm gonna put all of the creams in all together, all of these types of wipes. Now, I'm trying to keep things as organized as I can, and building this long-term kit, it's all about space in that bag. And if I just go piling stuff in there, then I'm never gonna find it, with the variations of things that we have there. So here we see the tubes of antibiotic, pain reliever, our oral pain reliever, itch reliever, things like that, rash. So these are gonna come in pretty handy too, but once again, I don't wanna just put these in there. They could get, punctured and leaked, so I at least wanna put them in another bag like this, so that if they do get a puncture, then it's not gonna get all over everything else in the bag. Now, another good idea that you could do, and that I probably will come back and do later, is on the bags themselves, is look at the expiration dates of your items and maybe write the soonest expiration date. If I have like 10 different items in here, and they all have different expiration dates, then I would write the expiration date here for the one that's going to expire the soonest. That way, when I look in here to replace that one, I'll have to go back and look at the other ones too, and maybe they're running close and go ahead and replace those. This is gonna come in handy. Isopropyl alcohol, gonna come in handy, and some hydrogen peroxide spray. Also, we're gonna be looking at adding in a lot of different medication. We got your standard acid reducer for your stomach, standard pain reliever, multivitamins, more Tylenol, some acetaminophen, it's called Banaprofen, but it's allergy medicine for those who have allergies. Then another type of allergy medicine, this is the off-brand of Claritin basically, so I like to keep that in there. And also some potassium iodine pills. All this though is gonna go on the exterior of my bag, or in the pockets on the outside. So these are gonna go in another small pocket here, or another small bag here. I also don't like to take a chance on anything spilling in the bag, so I'm gonna use a larger bag here for these 3 items. Some water purification tablets. Water purification, and I know that these may seem like it'd be something that goes in your bug out bag, and that's true. But if I'm gonna hand this bag off to a doctor or to a nurse that's in my group, then I want them to have all the tools they're gonna need. And that's the whole purpose of this bag, is a bag that someone can really make a difference with. The other box here of alcohol prep pads. And I also forgot here the children's ibuprofen. If you got young kids in your group, then having medication suited for those children is also gonna be not just a benefit, but really a necessity. I'm gonna start off with, I already know that I want to put these on my 2 side pouches or around the front here. So I'm gonna start off by putting the largest bottles on this side. Then I should be able to get the rest of these bottles in this side. Okay, so we've got all the bottles. So now let's look at somewhere to put all of these. And I'm thinking this front pouch here, if we open this up, I'm gonna be able to get these prep pads. Got the prep pads in here. I should also be able to get these, along with some bandages, Band-Aids I should say. I'm gonna zip that part up now, see if it'll fit. It may not all fit, I don't know yet. Let's see if it will. I want to overload it from the beginning. I do have a lot of storage in here, but we're gonna put a lot more inside this bag too. All right, so we got those there, and I'm just gonna take the rest of the bandages or Band-Aids and my tubes of medicine here, and I'm gonna put those there, and the water purification down in here. But I need to make sure also the pain relievers that we had in this pack, we'll put those in here too. I wanna make sure this is gonna zip up before I go any further though. All right, that zips up. And that pretty much fills up that section. We might could get a little bit more in there, but I doubt it. I don't want to overfill it. So what we got left is the interior here. Got the interior. So with the interior, I'm gonna start off with these, and I'm gonna put these right here. In this little pouch here, I can adjust that if necessary, but. All right, next we're looking at these areas right here, and these are some pre-made kits. Now I've looked at these and looked through them. These are mostly bandages and all. But these were originally Red Cross kits, and you got your antibiotic rubs there, or liquid I should say. A kit set up just for small cuts and scrapes. Not a lot in there, but it's already pre-packaged, and that's gonna come in handy. A triangular bandage, and a kit for severe bleeding and wounds. And this kit does have a stop bleeding agent inside of it. So this is a pretty good little setup to just keep right here to make it and keep it handy. So what I'm gonna do is, I'm just gonna keep these in this little Red Cross bag that I got right here. Now, I did a review on these the other day because I just think they're really good and really handy to have. And that's the alcohol filled and the iodine filled Q-tips. So these are extremely handy to have, and we're gonna put those in something in just a minute that's gonna keep those safe. Next, I have a lot of pain relief patch, heat patches, and 2 back pain relief patches. We want to get as much as we can. We've got our heat, and we also got an ice compress. You know, it's ready to go. You shake it, you break it and shake it, do the work. Pain reliever patch, so we want to get those in there. And also have the hot or cold compress here. There are a few other things we need to add in. We have some eye patches here, 4 oval eye pads. We got some rolls of gauze here. Are basically pretty, you know, straightforward devices. These extra absorbent pads, got a lot of these I want to put in here, and this is what those are. There's one of them out of it, and it's really thick and very absorbent, and this is made for a wound that's bleeding pretty bad. An island dressing, so a lot of different dressings, but I'm gonna try to get as many of these as I can in this kit. Here we have surgical dressings. These are extra large surgical dressings. They unfold and they're very thick. They're very thick, so these are excellent to have. So what we're looking here is the different types right here. Then you have a 2x3, several of those. This is a 2x2 gauze, 3x4 gauze, 5x9 gauze, 4x4s, and then a 4x10. So we got a little bit of everything, another 4x4. Not too bad. It's pretty flat. I think we'll get by with it. And we also have our waterproof tape. We want to find a place to put these, and I have a pretty good idea of what I'm going to do. I have this old first aid box. It's one of the ones that I just took all the stuff out of because really, you know, wasn't a great kit on its own. I mean, it wasn't that bad, but it didn't have what I need. So I'm going to use this. Oh, look at there. Perfect fit. Couldn't have been any better. All right, so now we have our liquid-filled Q-tips inside here. So organization is the key. If you organize your equipment well enough, you can pack a lot of things into one bag like this. So now let's put these in the bag and see how much space we have left, because there's still some more items I need to put in here. All right, to begin with, I'm gonna start off with the smaller set of these here, and these are gonna go right in behind the bottles, as you can see, right in behind the bottles that we put in earlier, and that still leaves us a good bit of space. Got the pain relief pouches that we saw right here, and the pain relief setup that we saw here. So that pain relief is gonna go right in here. So that still leaves me some storage area right here, and in that area, I do believe I can get the gauze in. So now, I've got the gauze in that area. So that doesn't leave us a whole lot here, but we should be able to finish off this kit. We still have our other gauze that needs to go in and our tape in this bag. So I'm not a doctor, and I don't pretend to be, but this is a surgical set of tools, and it has a lot of different tools. You have your scalpels and all. Then you have a military surgical set. I bought these at a store locally. Bought 3 sets of these when I originally bought them. I got one in my regular bug out bag. It's got a lot of things in here. It's got a lot of tools in here. It's got sutures, it's got scalpels. It's got a lot of equipment that a surgeon could use, you know, to help assist someone. So this is an important part of the kit to me, and you have all of your surgical tools here. This is not my specialty, you know, performing surgery on someone, but the thing is, having these tools, they would be extremely valuable to someone who does know how to use them. And that's what I'm looking at, is being able to help someone who can help other people or help members of my group. So the surgical tools are definitely going in the bag. We have to have a way to stop bleeding. And I have several different options here. And like I had said before, I want this to be as long-term a kit as possible, so I'm gonna put as much as I can in it. Now here, we saw the suture kit, this had a suture kit in it, but we have another suture kit here. And dump all this out, a lot of stuff here. But this is all part of the suture kits. Here you have your various needles and threads, several different types. Get most of these. I ordered these from a medical company off of eBay, and I've been happy with them. You can't really see in the pack, but they're the needle and thread, and here you see suture. All right. Then we have some tools. You have a set of hemostats and another scalpel in there, along with these are all scalpel blades. So a lot of scalpel blades, some of your antiseptic and alcohol wipes. I'm putting these in here with this kit so that, you know, in a need be, I could just grab this kit out of the bag and, you know, someone could stitch up someone else and I wouldn't have to look for the other equipment. Got everything you would need right here to perform or to suture a wound, okay? All right, now I have these steri-strips. These are outstanding. These are outstanding. These are used in place of sutures a lot of times, steri-strips. These, got a video hopefully I can find and I can put up on the screen to show you how they work. But the steri-strips are amazing. They're very adhesive, very strong, and they last for a very long time. These can close a wound and, you know, keep it from getting infected if you keep it clean. But very good. Now it's good to make an inventory list as you go. I'm gonna keep all of the clotting agents. I believe these are important, so I'm gonna keep all of them. A tourniquet. You know, this can cause you to lose a limb if it's left on just a little too long. But it can save a life in the short term. It can definitely help save someone's life. If our staplers, these are skin staplers, and these work in place of sutures. I'm not gonna open these, not in this video. I may do a review on one later because I've got some fake skin coming and I wanna start practicing suturing that up. And when that gets here, I'll make a video of that, suturing it and stapling it. But for now, these are your skin staplers with staples. Here is a staple remover, okay, the staple remover. Now here's something that I definitely don't know how to use. It's an IV kit, and an IV kit, for someone like me, this is not gonna help much, but for a trained professional, this can definitely be a lifesaver. So this is something I carry, like I always say, not for me, but for those who can help me or help my group or, you know, help someone else. So it's always good to have stuff like this. Also, one thing that I do want to add in that I need to get to put in this kit is also a sucking chest wound kit. And I meant to pick one up, but I didn't pick one up, so I know that that is an addition that I do need to add to this kit. But there are a couple of other tools. This kit may actually have to turn into a 2-bag kit, but there's a couple of other tools that I still want to include. Now, these are not necessities by any means, but I do believe that a medical professional, if I was to give them, you know, this bag so that they could do their job and help people, you know, help people around, then I think they would really appreciate it. And there's simple things like this. A blood pressure cuff. I think that when a doctor is treating someone, he's gonna wanna know their blood pressure. So I'm gonna put in this kit 2 different types of blood pressure monitors. Here, we have the finger monitor that can read it. So I'm going to also keep that in there because this is like, it's not like it's something that I use around the house every day. So this goes good in my long-term kit. I'm gonna carry these 2, so I'm gonna find something to put them in. But there's a couple of other items that I also want to include. And a stethoscope here. All right, so we have these devices. We have these. So it's starting to pile up. We're starting to get a lot of equipment, but there's also some other things. I gotta step back a little bit and look at some of the other basic resources that I haven't included yet. And that's a couple of emergency blankets because it may be cold weather when someone's treating someone and they have to cover them up. So I'm gonna carry at least 2 in there. Also, a little bit of chapstick that I'm probably gonna put in here in this red cross bag because there's space in it. Go ahead and put it in there. And I think we're about at our limit, but I wanna make sure that we're not forgetting everything. There are a couple of other items that I definitely want to add on. Some of these being rubber gloves that we have here. Some small, you know, cleanup kits. Also have a snake bite kit here that I want to add in. This one's broken. I'm going to tape it together. It's still good. It's just I broke the thing and I never have used it, so I'm going to include it in this kit. Yeah, 100 more surgical blades for your scalpel. So we want to include those in. Also, a couple of these wet towels or expanding towels. Some tongue depressors, a pocket CPR mask. It's never been used, and this is the CPR mask that you put on someone's face as you give them mouth to mouth. It may come in handy. Some drawing salve to help draw out an infection. These work pretty well. A couple of other things that I also want to include, and that's purified water. And The water's not going in here as drinking water. The water's going in here in case whoever is using this kit to help someone has to clean, wash their hands, wash a tool or something, that they have some purified water that they can work with, clean off wounds, things like that. So at least a little bit to work with. This will also go into one of the larger Ziploc bags. So the trick is, are we gonna be able to get all this into that one bag? And I got my doubts, but let's give it a shot. I'm gonna start off by putting the safety pins, tongue depressors, the toothbrush, all in one kit here. Put all those in one bag, and don't think there's anything else I could add into that bag. I could add in, here are these little cleanup packs. They're just little packs, sanitation packs that allow you to clean yourself basically, clean your hands, clean your body, whatever you need to do. So that's gonna take up those. So we've got that bag there now. Okay. This is probably gonna require a larger bag, but we're gonna see here. Now, on the sides here, I know that I have room probably for these light sticks. So I'm gonna go ahead and put those in here where I have my bottled medication at, and that allows that to close. And there's also room in here for these small little tablet, and I can get the salve in there also, making the most of our room. Now I'm gonna put the snake bite kit in there too, but I'm gonna have to tape it off first. So I'll tape up the snake bite kit, and I'm also gonna put it right here. So, all right, that still fastens. Yep, it fastens pretty good. Now, remember, this is not a kit I'm gonna be running with probably. This is a kit that I'm gonna take when there is an absolute emergency, or I'm going to give to someone who can use it. Emergency blankets, gonna place those in this outside pouch here. And it looks like I'll be able to get all three of them in there. Okay, good. I actually have a little bit more space. Not sure that I can get anything else in there. What we're left with now is the interior. So hopefully I can get most of my tools in here. Now some of them I may have to leave out, but we're gonna try, and we're gonna start off with the most important ones. First is gonna be the stop bleeding agents. And I know that these can go right here, along with the gauze and the other stuff that we had. They go right here on the top. All right. Next, I'm gonna take the tourniquet, and I'm gonna place the tourniquet beside the bottles here. So the tourniquet is now beside the bottles there. Next, I'm gonna take the staple remover out and place it inside this surgical kit. Next, we have our steri-strips. Now, the steri-strips I'm going to place right here in front of these cold compresses that we had put in earlier. That way I know right where they're at. All right, so great, we still have some room. Next, now I've got a lot in here. I don't want it to fall out, so I'm gonna do a little bit more organizing later on, but right now I just wanna make sure that everything I've chosen will fit in here. This fits perfectly right there. Actually, I'm gonna turn around that way, where the largest of the bulk is toward that side. Gives me more space right here. All right, next is our staplers. So these are our skin staplers, and we got some more surgical blades here. So I'm gonna take both of the staplers, and I'm gonna put one on this side and one on this side right here. So we still got some room left. We may be able to get a bit more in here. All right, so next, I'm gonna take a few rolls of tape and place them in this small bag, and that way I've at least got several rolls. Feels like I got a pretty good spot that I can fill the tape in right here to the side. I don't wanna put it too far down. I want it to be easy to get to, so I'm gonna just place it right on the side right here to where we can get to it. So we have our little smaller kit here, and I'm gonna place this right on the side of the surgical equipment because there's a little space there, not much. Gonna place the rest of the gauze here. Gonna place the rest of the gauze right there. And behind the gauze will go the IV kit. So as we can see, it's pretty full right now. I mean, this thing is absolutely full, and I probably need to get a better bag, and that's what I'm gonna do next. We have our small pack right here, and maybe I will affix this to the strap on the side because it does have a strap on the back. So all we have left of what we looked at here is water. And the water itself will go in a Ziploc bag. Take it, let's see if it'll close. A lot of stuff in here. The thing that I'm missing that I really would like to include with this, and that would definitely be the sucking chest wound kit, one that can treat that type of injury. So that's something I definitely need. I'm missing that. I'm missing a few other small items, but overall, this is a kit that I do believe I could hand off to a doctor or to someone else, and they would be able to do some good, to help some people, possibly even help members of my group. So leave in the comments below if there's anything you want to add, and I'm gonna reshoot this video very soon, so for the future video, I'm gonna have a much larger bag, and I'm gonna add in the things that I didn't add in today. So, well, that's it. I hope the video helps. Thanks a lot for watching, and Serious Survivor out.